Hello, my name is Rachel Lewis and I'm from PPL, just PPL. And I'm a senior consultant and I'll be talking you through our journey over the last really year and a half, supporting the Isle of Man to become the world's best small island health and care system. And if we could go to the next slide, welcome to the Isle of Man. So the Isle of Man is a small island in the Irish Sea. It has a population of around 80,000 people, and the Isle of Man is a Crown dependency, so it's not part of the United Kingdom, and it has its own health and social care system that isn't part of the NHS. And this is both a challenge and an opportunity when it comes to health and care on the Isle of Man. The challenge is that the Isle of Man's population have recognised for a number of years that the Isle of Man's quality, outcomes and patient experience have fallen behind international best practice. And that's a significant source of concern for people who live on the Isle of Man, of course. But the opportunity is that everything from policy decisions to frontline delivery is decided, organised and takes place within this small self-contained local area for a population of 80,000. So we at PPL very much thought if you can't achieve an integrated system in the Isle of Man, surely you can't achieve it anywhere. So we were really excited to be a part of a very ambitious project on the Isle of Man to fully review their health and social care system, define new operating models of ways of working with patients and staff, enhancing integration, and also looking carefully at how we could achieve a sustainable financial future for the Isle of Man's health and care system, because that was a point of deep concern at the point where we started the review back in 2018. So fortunately, we had a great team around us to help us address this big project. So I worked on the project with colleagues from PPL. We are a social enterprise based in South London. We exist to promote better health, wellbeing and economic outcomes across the UK, and we largely do that through consultancy projects. We worked on this project in partnership with GemServe. They are a specialist market design, governance and assurance consultancy. And we also collaborated with a small team of Isle of Man civil servants as part of the project team, who were absolutely invaluable in helping us plug into what was going on the ground and provided a huge amount of local knowledge. And finally, the review was led and chaired by Sir Jonathan Michael, who is a medical consultant, a former hospital chief executive and an expert in NHS transformation. And so him providing that kind of chair and leadership role really brought a lot of weight and credibility to the review's recommendations. So that was a really important part of our team setup as well. So how did we approach the challenge of reviewing how an entire health and care system works and how it's funded? We started by doing some primary research. So we engaged around 150 stakeholders within the system, so health and care professionals, through interviews and focus groups. We also engaged much more widely with the public through roadshow events, networking events, and a public consultation survey that brought in the views of hundreds of people. And we gathered quantitative data where it was available, but often it wasn't available. So a key part of our approach to the review was secondary research into comparable health and care systems from around the world and similar review exercises. So we drew on modelling and information gathered for the NHS 5-year forward view on funding systems from Sweden, Japan, China. And we thought, really, if we take the lid off, how can we fund health and social care for the future in the Isle of Man? And then finally, we put together a case for change. So we delivered a report with 26 key recommendations for creating the world's best small island health and care system. And then we also put together a financial model forecasting growth and demand, a range of future efficiency targets, and a range of funding options to meet the expected future costs of health and care. And really, just to stay on the slide for a minute, the most important thing linking all of these phases together was the engagement approach that we took. So from the beginning, we developed our primary research and then our secondary research in consultation and collaboration with people from all aspects of the health and care system on the island, including involving patients and service users. And then when we developed our report and our model, we tried to do that in a very iterative way. So bringing draft and interim reports and models and testing them in focus groups and workshops and through like midway publications of our findings to ensure that by the time we finally reported, what we were saying reflected what people on the Isle of Man really thought, and there were no surprises, and people were kind of brought with us on the journey of the review, which really was the key thread throughout the approach. Next slide. Thanks. Why did we choose this approach? Firstly, to overcome data shortages, like I mentioned, we couldn't rely on fully accurate and complete data from the Isle of Man itself. We also aimed to provide a dynamic model that meant it could be useful for longer, so we created the model in Excel and in a way that was user-friendly. Thirdly, we wanted to create a sense of ownership in the results by engaging as many people as we could in the process, so that by the time the review was delivered, people would feel ready and bought into the idea that change was needed. And fourthly, we wanted to create a replicable and scalable approach and to try out this way of developing a review report that could then be applied in other environments where data quality is poor and there's a history of reviews and lots of previous initiatives that haven't really led to change. What did we achieve? Three things that we've achieved since I put this slide together, I would say, as we're still doing work in this project. So in March 2019, the Isle of Man's government approved all 26 recommendations from the review, which we were really proud to see. And we were especially delighted to see that patient representatives and voluntary sector leaders felt that the review addressed their concerns and provided a clear and credible roadmap for the future. So not just describing the problems, but moving towards solutions. And the Treasury released an initial tranche of transformation funding, which we were also very pleased to see because the review found strongly that a history of underinvestment had led to rising costs. So we were very keen to see that that invest to save approach was taken forward. And then since May 2019, well, really since November 2019, PPL and GEMSERV have been involved in supporting the ongoing transformation programme. So the Isle of Man is now currently delivering a health and care transformation programme touching all areas of health and care to try and bring the findings from the review to life. And we are looking at legislative changes, pathway improvements, building on quality improvements as well. And I think just to give one illustrative example, I was in a meeting with a dermatology consultant the other week, talking about service changes to finally reduce waiting times for outpatient appointments. And I was remembering being in a focus group 2 years ago when a patient had said, I had to wait so long for an outpatient appointment for dermatology that my GP told me to go privately, and how difficult a decision that had been for them. And so to see what patients have said they needed throughout this process now starting to translate into reality is something I'm very proud of to have been a part of this project to see. Yeah, it's an ongoing process, obviously, and the transformation programme we expect will run for the next 3 or 4 years at least. So ongoing, but starting to deliver. If we could move to the next slide. So the challenges we faced on this project were similar to many transformation challenges. There had been a history of reviews that hadn't led to change in the Isle of Man. So what we tried to do is create a case for change that focused on excellence and becoming the best small island health and care system despite constraints. And we also tried to build in information from other systems to show that even though we weren't sure and that there was poor data reporting and data was inaccurate and incomplete, we could still demonstrate that the current system was unsustainable and it wasn't an unanswerable question. And then the final challenge that we faced was the lack of trust within the system and ongoing disputes. And what we felt made the difference in this project is throughout the review process, we tried to model inclusivity, clear communication and transparency, which began that process of challenging unhelpful behaviours and helped to bring people into a place where when we delivered the report, the process of change felt doable, ready to start. It was something that could be believed in. Next slide, which is my last slide. So I'm nearly at 10 minutes, but just to summarise some key takeaways from the project. First one, we would say don't underestimate the impact of change. So setting a really high bar and trying to set our aspiration as to be the best has really helped to galvanise this project. Numbers 2 and 3 could be summarised as just engage widely and deeply. We found that was important not only to have connections with our key stakeholders, but to bring in people from across the system. And finally, we found that taking an iterative approach to model development, as well as the qualitative findings that people tend to usually engaging around the finances, was really critical, because people had to be brought into the numbers and the kind of business case for this transformation to actually enable it to start taking place. Yeah, well, that's my time. There's loads more to say about this project. If you ever have any questions now or later, those are my contact details. Do get in touch. We love to talk about what we do.